This is seriously impressive. A rookie doctor, armed with nothing but a needle and a urinary catheter, pulls off an extremely challenging reboa, rescuing a patient whose leg artery has burst and is gushing blood like crazy. The hospital director tells the other docs, "I beg you wouldn't even dream of using such a technique." So, what on earth does the good Dr. Sean do? Let's dig into the details. It's getting late. Most of the hospital departments have already shut down. Right about now, the emergency department gets a call. It's a major emergency. A bus has a blowout and flips over. A huge accident has gone down, and 24 patients with various degrees of injury are about to roll into the hospital. The hospital promptly kicks into emergency mode. All the on-duty staff from every department hustle over to to lend a hand. And the whole surgical crew where Sean belongs is all assembled. Everyone's standing in the lobby. What's coming up is gonna be one heck of a fight. A massive car crash has occurred and 24 critically injured patients arrive at the hospital. Do you know what those different colored trauma tags on patients signify during an emergency? Sean pipes up. Green means it's not too bad. Yellow means keep an eye on them. Red means they need immediate attention. And black, well, they get sent straight to the morgue. Just then, the ambulances start pulling up, and the patients start streaming in. The first injured patient has a red tag and gets rushed to the front of the line. The second patient gets wheeled in. He's got second-degree burns on her neck, chest, and left arm and also sports a red tag. Immediate treatment is a must. Dr. Kalu steps right up and volunteers. He'll handle this one. The third patient was tossed out of the bus over 30 feet high. He's got multiple bruises on his chest and is having trouble breathing. His pupils are reacting sluggishly. An emergency chest opening is called for. The doc says she take care of this and tells Dr. Claire, "You grab the next red tag patient." And then a bunch of patients with green tags, the ones with minor boo-boos, start coming in. Before long, another red tag patient gets wheeled in. She's already passed out cold. There's a metal object stuck in her neck. Dr. Claire takes this one. Dr. Melendez is worried that Dr. Claire might be in over her head, so he swoops in to help. This patient is on the verge of death. This patient's carotid artery is clogged. Blood ain't flowing no more. Right now, the patient's pulse is dropping like a rock. Immediate first aid is crucial, but Dr. Claire is just standing there, shell-shocked and clueless. It's clear she's freaked out by all the gore. Dr. Melendez quickly snaps her out of it, saying, "Treat him like any other patient." What would you do? Dr. Claire then snaps back to reality and dashes off to grab the first aid kit. At this moment, Sean's still planted in the lobby, eyeballing the incoming patients. Sean activates his perception superpower and scans to figure out which patient is meant for him. Looks like it's not too bad. There are more patients with green tags. All of a sudden, 3 of the cops wheel in a patient. No need to look twice. It's a red tag patient. As soon as they barge through the door, the cops holler, "Get over here and help. This guy's in a real bad way." The doc says, "Sean, you take this one." But Sean just freezes on the spot. Can an autistic person really be a doctor? The old nurse goes over and yanks on Sean, "Get a move on." But Sean just stays put. The nurse barks out, willing to trauma 3 pronto. She gives Sean this look of disappointment. She's probably thinking to herself, at this critical juncture, Sean with his autism ain't gonna cut it. And Dr. Melendez and Dr. Claire, who are standing close by, catch this whole scene. Right about now, Sean's skin wraps up. His next trick up the sleeve is treatment. Sean strolls up to the injured fella. The cops pipe up. His bleeding won't quit. The second we let go, his wound will spurt blood like a geyser, so we ain't budging an inch. Sean checks out the patient's condition and tells the cops to let go. Holy smokes, the blood shoots up over a foot high. Sean slaps his hand right on the wound. This is Sean's first rodeo with a patient with severe external bleeding. Generally speaking, if a person loses more than 30% of their blood, they're flirting with death. This patient's about to bleed out. The nurse is on Sean's case, badgering him to come up with something, and fast. Dr. Melendez has a front row seat to all this from a ways off. He's itching to jump in and help, but also can't wait to see what Sean's made of. He's wondering if Sean's got what it takes when the chips are down. Sean probably mulls it over for about 20 seconds. The whole place goes dead silent. The good Dr. Sean is truly amazing. He's about to pull off the mother of all difficult emergency surgeries. Sean calls out, "I need a urinary catheter, a 14-gauge needle, an arterial guide wire, an occlusion balloon." and 20 milliliters of normal saline. Chop chop. The stuff Sean asks for shows up lickety-split. Sean gets down to business. Just then, the hospital director comes huffing and puffing. Sean grabs a big syringe. The nurse asks, "What are you up to?" Sean shoots back, "Ain't nothing ready-made. I gotta whip up a Reboa myself." The nurse is gobsmacked. "What? You're gonna make what?" "Make a Reboa," Sean says. The nurse freaks out right away. "In the shape this patient's in, you're gonna make a Reboa from scratch." Did I hear you right? Sean picks up a tube and gives a quick rundown. Reboa can plug up the busted artery and stop the bleeding in a jiffy. Sean's spiel is overheard by Dr. Glassman, Dr. Melendez, and Dr. Claire, who are standing nearby. Without batting an eye, Sean jams the tube straight into the patient's femoral artery. The brainiac Dr. Sean fires up his everything's got a diagram skill. Instantly, the patient's blood vessel blueprint pops up in his noggin. Sean zeroes in on the right spot. He don't mess around. He shoves the other end of the tube right back into the patient's body. Sean tells the cops, "You can let go now." The cops look at him like he's lost his marbles. "This is an open wound. You're telling me it'll stop bleeding just with a tube and no bandaging." They let go. Lo and behold, the wound quits bleeding. The blood pressure levels out. The patient's life is snatched from the jaws of death. Dr. Melendez, who's been eyeballing this from afar, is practically ready to teleport over and get a closer look. How the heck did Sean pull this off? The old nurse nearby cracks a smile and says, "That's one heck of a move, Sean. I've been in this game for decades. First time I've seen someone do a Reboa so slick. From the get-go to the finish line, it took about a minute flat. Let's check out the other side of the action." Dr. Kalu's got his hands full. The patient's got burns all over. Right now, the blood oxygen levels drop to 89. It's time for some serious first aid. After examining the patient, Dr. Kalu figures out that the patient's throat's all swollen up and she can't breathe. The fix is to cut through the cricothyroid cartilage. In plain English, that means slicing open the throat and sticking in a tube. Never underestimate a seasoned old doctor. The surgery chief ain't on board with Dr. Kalu's plan to do the cricothyroid cartilage surgery. It ain't needed. You're making a federal case out of nothing. Just do an escharotomy. Hand me the scalpel. I'll take care of it. The chief makes the slices, and sure enough, the patient can breathe easy peasy. When the neck's burned, the skin shrinks up real bad, leading to breathing troubles. All you gotta do is cut open the charred skin covering the windpipe. By this time, most of the seriously wounded patients with red tags have been taken care of, and everyone's on-edge state of mind starts to simmer down. Right about now, Dr. Glassman and Dr. Melendez are chatting. Dr. Glassman says, the Reboa that Sean pulled off was super imaginative. But Dr. Melendez fires back. It was ballsy, but also mighty risky. Dr. Glassman counters, but Sean nailed it. This is probably something you wouldn't even dream of trying in a million years. How many times does Sean have to prove himself before you're willing to cut him some slack? Dr. Melendez clams up. While washing their hands, Dr. Melendez grills Dr. Claire. "What were you doing just standing there like a bump on a log and not helping the patient?" Dr. Claire defends herself. "I was cooking up a treatment plan." Dr. Melendez snickers. "You were just scared spitless and didn't have a clue what to do." What Sean did was actually thinking up a treatment plan. Dr. Claire feels all kinds of awkward. Dr. Melendez keeps going. You could pick up a trick order from Sean. From this, it's clear that Dr. Melendez is starting to cotton onto Sean's chops. This gal is really down on her luck. She's only 20 years old and got hit with some gnarly burns. Dr. Kalu's treating the burn on her neck. The patient's dead set on seeing what she looks like. Dr. Kalu has no choice but to pass her a mirror. The girl breaks down crying. She's always daydreamed about wearing a wedding dress, but now it seems like nobody's gonna marry her. On the flip side, the patient that Sean did the Reboa on is named Marco. Marco's condition is stable for now, but he's gonna lose a leg. When Marco's parents and bride find out that Marco's gonna have a leg lopped off, they huddle together in misery. Afterward, Sean quizzes Dr. Claire. Why are Marco's family so torn up? Losing a leg is way better than kicking the bucket, ain't it? Dr. Claire explains, the family needs time to wrap their heads around it. Sean stares at the CT images for a good long while and fires up his everything's got a diagram skill. Finally, this brainiac comes up with a fix. He drags Dr. Melendez to the 3D printing room. Sean's actually gonna use 3D printing tech to print a thigh bone for Marco. But Dr. Melendez has some qualms. Before this, 3D printed bones have only been successfully used on human jaws, and a thigh bone has to hold up half the body's weight. It's gotta be a tough nut to crack. But Sean jumps right in. This is a titanium alloy thigh bone. It'll be just fine. At this moment, Dr. Melendez has a pretty big chip on his shoulder about Sean, so he ain't too keen on Sean's idea. Dr. Claire's a real pal and insists that this is her own bright idea, not Sean's, and lays it on thick with Dr. Melendez. Only you can pull off this history-making surgery. Dr. Melendez gives in when he hears that. But when they break it to Marco's family, there are some differences of opinion. Disagreement 1. Because the surgery's got risks, with a 20% chance of croaking, the parents are all for conservative treatment and having a leg amputated so their son can at least stay alive. Disagreement 2. The bride reckons that Marco's always been nuts about the outdoors. Losing a leg will suck the fun right out of his life. He should go for a titanium alloy leg so he can live like he used to. Eventually, this sped makes its way to the courthouse. Marco is about to lose his left leg. Should it be hacked off to save his bacon, or take a gamble and swap it for a titanium alloy leg? The judge shows up to make the call. A 20% chance of death for the leg replacement is no joke. What's the judge gonna decide? Dr. Claire gets the lowdown from an injured patient that there's another injured patient who never made it to the hospital and might be at the accident scene. Dr. Claire ropes in the police to go hunt for the person. Finally, in a backwoods place, they find the critically ill patient, Jenna. Dr. Claire sticks a tube in her and uses a breathing bag, but Jenna's got a cerebral hemorrhage and her pupils start to widen. The pressure in her noggin is sky high. Immediate action's gotta be taken, or she won't even make it to the hospital. Dr. Claire borrows an electric drill, gives it a quick once-over with disinfectant, and drills a hole right in the skull. This is also the first time Dr. Claire has ever done this. The two cops standing nearby are gobsmacked. Dr. Claire pulls it off and then ships Jenna off to the hospital. Remember this tidbit here. The emergency doctor gives the tube a little lift. This is the toughest judgment the judge has ever had to make, to decide whether Marco should have his leg amputated. But Marco can't hold out any longer. He's got a blood clot and needs surgery pronto, or he's a goner. A few seconds before waltzing into the operating room, the judge finally rules. The bride wins. The titanium alloy thigh bone replacement gets the green light. Dr. Kalu puts in a request to use tilapia fish skin to treat the burn area of the burned woman. This can fix up the tissue in a jiffy. But truth be told, the cost of fish skin transplantation is through the roof. Dr. Kalu secretly foots the bill for the patient himself. At this time, Jenna, whom Dr. Claire saved, is also wheeled into the operating room. All the surgeons are on deck. The leg replacement surgery, the craniotomy, and the skin grafting surgery are all going down at the same time. With Sean in the leg replacement surgery, it sails through. The skin grafting surgery, which ain't life-threatening, also goes without a hitch. But Dr. Claire and Dr. Glassman, who are doing the craniotomy on Jenna, get the craniotomy part done smooth as butter during the surgery. But Jenna stops breathing not long after. Yup, Jenna kicks the bucket during the surgery. The doctor screws up during first aid and causes a patient to die. After the surgery, the emergency doctor spills the beans to Dr. Glassman that when Jenna was brought to the hospital, the intubation was too deep, which might have messed up the lungs. Dr. Glassman gives Dr. Claire the heads up. Dr. Claire didn't see it coming. She managed to drill a hole in Jenna's head but dropped the ball on the intubation, didn't spot the patient's flailed chest, and ended up damaging the lungs and losing the patient. A doctor's got a heart to save lives, but the patient died because of one's own blunder. Dr. Claire's mighty sad and breaks down crying. Dr. Glassman says this secret needs to stay under wraps for good. Dr. Claire makes up her mind to become a more kick doctor. It's been a real crazy day. Sean and Dr. Glassman go grab some pancakes. Sean says, I want to scarf down 5 in one go. This is episode 6 of season 1 of The Good Doctor. Accidents always pop up out of nowhere, and death is a force to be reckoned with. But no matter what, the human hankering to survive and our toughness always help us muddle through the tough times. Well, that's all for this episode. The Good Doctor series will keep on coming. If you like it, remember to hit that like button and subscribe. See you next time. Bye.